Every black person knows somebody with sickle cell. But when I ask black folks about sickle cell, no one actually knows what it really is. It's my job to inform you so that you can know. Sickle cell anemia is an inherited blood disorder characterized primarily by chronic anemia and periodic episodes of pain. The underlying problem involves hemoglobin, a component of red blood cells. Hemoglobin molecules in each red blood cell carry oxygen from the lungs to the body organs and tissues and bring carbon dioxide back to the lungs. In sickle cell anemia, the hemoglobin is a little bit different. After hemoglobin molecules give up their oxygen, some may cluster together and form long rod-like structures. These structures cause red blood cells to become stiff and assume a sickle shape. That's why it's called sickle cell anemia. Unlike normal red blood cells, which are usually smooth and donut-shaped, sickled red cells cannot squeeze through small blood vessels. Instead, they stack up and cause blockages that deprive organs and tissues of oxygen-carrying blood. This process produces periodic episodes of pain and ultimately can damage tissues and vital organs and lead to other very serious medical problems. Normal red blood cells live in the body about 120 days, but sickle cells die after about 10 to 20 days. Because they cannot be replaced fast enough, the body is chronically short of red blood cells, and this is actually called anemia. This genetic adaptation allowed black people to survive in Africa during the epidemics of malaria, so I don't really like to call it a defect. I tend to think of it as more of a survival of the fittest phenomenon. Sickle cell anemia is an autosomal recessive genetic disorder caused by a variation in the HBB gene, which codes for hemoglobin. The presence of two defective SS genes is needed for sickle cell anemia. If each parent carries one sickle hemoglobin gene and one normal gene, each child has a 25% chance of inheriting two defective genes and having sickle cell anemia, a 25% chance of inheriting two normal genes and not having the disease, and a 50% chance of being an unaffected carrier like the parents. Sickle cell anemia affects millions throughout the world. It is particularly common among people whose ancestors come from sub-Saharan Africa, Spanish-speaking regions such as South America, Cuba, Central America, Saudi Arabia, India, and Mediterranean countries such as Turkey, Greece, and Italy. In the United States, it affects around 72,000 people, most of whom ancestors come from Africa. The disease occurs in about 1 in every 500 African American births and 1 in every 1,000 to 1,400 Hispanic American births. About 2 million Americans, or 1 in 12 African Americans, carry the sickle cell trait. And it's a big myth that if you have just the trait, you can have symptoms. Sure, it's happened, but about 1 in a million. So now you know what sickle cell is. In the next segment, I'm going to give you the symptoms and what to do about this very serious disease. I'm your favorite doctor, Dr. Corey Hebert with BlackHealthTV.com.